Yes, I'm here.
Okay, great. I just wanted to make sure. I think you're on a phone number instead of your name. But, well, welcome everyone. My name is Cindy DeWeese. I'm the president and CEO of the Clear Lake Area Chamber of Commerce, and we're happy to have you join us today for our Back to Business webinar, Inside COVID-19. We're thrilled to be together and hearing from Dr. Moosa with Science Behind Beauty. That's his business and our chamber membership. So to ensure we have plenty of time for questions, I'm going to jump right into a few housekeeping items. First, to have the clearest connection. During this webinar, we're asking you, except for the speaker, to turn off your camera during the presentation. So we encourage you to change your display to speaker view. And second, please be sure to mute yourself, which I think most of you have. But if you have questions, either use the chat feature, because I'm sure we're all going to have questions. Be sure to use the chat feature, or you can email our Chamber Vice President, Sherry Sweeney, at Sherry, S-H-A-R-I, at clearlakearea.com. And she can ask the question for you. And again, S-H-A-R-I, at clearlakearea.com. Now I'd like to introduce our Vice Chair of Research, and she holds two roles with us as our Healthcare Industry Liaison, Rebecca Lilly with Memorial Hermann, to introduce our speaker. I'm going to turn it over to you, Rebecca. Thank you.
Good morning. Thank you, Cindy. Thank you, everyone, for joining us this morning. First, I'd like to recognize our sponsor today, Clear Lake Specialties. Clear Lake Specialties was founded in 2005 with a mission to provide outstanding medical care to Clear Lake and surrounding areas. They are a physician-owned, multi-specialty group with over 74 providers specialized in inpatient and outpatient care. They partner with local healthcare institutions to deliver exceptional medical care to their patients. Their mission is to be dedicated to providing their patients with comprehensive specialized medical care. They believe that compassion, knowledge, and skills are all necessary to deliver the best care. Their staff is committed to providing every patient with respect and personal attention they deserve. Thank you, Clear Lake Specialties. As we get back to business, it is important to have the facts to keep you and your employees safe. While caring for a patient at the very beginning of this pandemic, Dr. Moosa fell ill with COVID-19. Dr. Moosa is going to present an update on the virus, plus share his unique perspective as a patient and a physician. Dr. Moosa's goal is to give the best medical care. Honest and open communication is paramount. There have been many advances in medical technology and treatment. However, the patient is always a person first. Dr. Moosa is a member of the Texas Medical Society, the Islamic Medical Association of Houston, and the Harris County Medical Society. Dr. Moosa attended St. George's University School of Medicine, where he received his doctorate of medicine in 1988 and completed his residency at Seton Hall University. Please join me in welcoming Dr. Moosa.
Well, thank you very much for the kind introduction. So yes, my name is Dr. Moosa. I'm a family physician. We have two offices. I'm in LaPorte area currently. We have a wound care office, which is with Clear Lake Specialist in the Webster location. So I specialize both family medicine, wound care, and hyperbaric medicine. In the LaPorte location, we have mainly the preventive aspect of healthcare, which is called MDVIP, where I try to prevent heart attacks, strokes, and illnesses like that. What happened, unfortunately, with this virus, to let you know, we sort of knew about this virus late last year. It was coming out of the Chinese province of Wuhan. And unfortunately, I think some of the guard was let down and it traveled over here. And so now we are dealing with this pandemic that's global. And unfortunately, we're seeing currently the second wave that's going around in the southern states. To give you a little perspective of the testing, I just looked at this morning, UTMB from March to just about a week ago, they have done about 50,000 tests on patients. And about, they have close to 4,000 to 5,000, but actually more than 4,000, there were positive test on that one. So it tells you it's about 6%, I guess, if you want to say it, positive tests, or the people who are being tested on this virus. We are seeing a lot of asymptomatic, meaning that people who have no symptoms and they're testing positives. This virus, first of all, is a unique virus. We have never encountered it. It is in a family of viruses that we knew about called the coronaviruses. Coronaviruses had about 6 of the siblings, basically, if you want to put it that way. And this is now the 7th sibling that was just born recently. Because we don't know about the virus, we don't know how long it'll be around. We don't know whether if you get infected, whether you get reinfected down the line, how long will your antibodies last? So those are questions that some people do have in my office. Unfortunately, no answers are there. And March 16th, what happened is that, and this was just before we were given guidance about masks and all those things. I had a patient that I've known for about 20 years. She came in with a cough, no fever, nothing like that. And I saw her, and she always comes for allergies, and she had the typical itchy eyes, sneezing. So, okay, allergies. But I had to examine her, so I was looking in the ear, listening to her lungs. I did not have a mask on at that time. Next day, she calls me, saying she has fever. So I was like, okay, well, fever should not be with allergies, so something else is cooking. And at that time, we did not have, the local community did not have the COVID testing kits available yet, okay? They were mainly at the CDC and the big centers and other places like that. The Harris County, the CDC was then revving up testing with the cities and counties and other things like that. So the solo physicians, us, we are sort of left on the back burner of getting supplies or anything like that. Well, the next day when she called and had the fever, I did the routine swab for other viruses and bacteria. And Thursday, I got the results on her, and it was negative everything. So she did not have any of the virus. So that made me more concerned because we did not have the COVID testing. So I felt like, yeah, she might have it. Thursday, I started feeling a little sore throat. So I canceled the office. I did not want to take a chance. Friday, I was feeling feverish, sore throat, body aches. So I stayed home. And I did separate from the family at that point. Also, I didn't want to take a chance on anything. Then Sunday, she calls me saying the test that she had gone to the city site, she had received a call and it was positive that she's positive for COVID. I said, okay, well, I was the next 2 years, so technically I was exposed, so I had to be a 2-week quarantine according to CDC. Monday, I called a local physician who finally had the testing kits available, so I went ahead and had my test done. Wednesday, I got the call saying, okay, you're positive also. The labs were scratching their head at that time because I had another coronavirus actually going on at the same time that I was feeling sick for. They did not expect 2 different coronaviruses to be at the same time in an individual. So it was a surprise to some of the physicians and myself including with that. So here I was, okay, well, 2 weeks I'll have to take off. And I was feeling better to go back to work, but I said, okay, no, I have to do the due diligence. So I went and stayed home. Then I started having cough about the 3rd or 4th day. And at that time, because we didn't have any other guidance, so I was on the hydroxychloroquine and the Zithromax. And I was taking that medicine, but the cough was becoming worse and worse. And day number 10 into my diagnosis, I suddenly went to a fever of 104. My appetite completely went away. I was taking like 2 bites and I couldn't take it anymore. The sense of smell was gone basically. And I was going up about like 4 or 5 steps at the house and I noticed I was getting short of breath. Now, mind you, I don't have any illnesses. I don't have diabetes, high blood pressure, emphysema, nothing like that. I don't take any medications, prescription. I just take vitamins and supplements like that. And I work out about 4 or 5 times a week. So I was pretty fit, and so that sort of shocked me. I'm like, oh my God, I'm going 4 or 5 steps. I'm getting very short of breath. So it concerned my wife also in that time, and this was on a Sunday. So I called the doctor up. She goes, you know what? You're getting worse, so we need to not take a chance. Let's have you go to the hospital and get an x-ray and other things like that. So my wife drops me off at the hospital. Now, at that time, because of the COVID situation, no visitors are allowed. So she drives me at the UTMB facility here in Clear Lake. and there's a tent outside. I enter the tent and they tell her, nope, you have to go outside and sit in your car. You cannot come in. So I wait for the processing. Then they take me inside the building from the tent. And I had already contacted a local physician that I knew who was there. He came and saw me in the emergency room. Chest x-ray was done. It showed touch of pneumonia. Now, during that time, x-ray and blood and all those things itself, they went ahead and did the testing, the COVID testing again on me. It had been about 2 hours. So my wife had been sitting outside in the car for 2 hours waiting to get some answers as to what's going on. Finally, the doctor told her, hey, I'm not going to release him. I'm going to put him in the hospital. Why don't you go ahead and go home? So she went home and she was telling me, going to an empty house was kind of scary to her because she had not heard from me. I was going through the x-ray and then being transported to the room and things like that. So finally I called her to say, I'm in a room, a little short of breath, but I'll contact you later on. It was close to midnight when I got into the room. I was put in an ICU room. Now, an ICU room at that point at the hospital is completely sealed room, okay? You have a television, and anybody entering the room has the spacesuit type of things going on. And because of the shortage of PPE equipment, only the nurse in the morning would come in, and the nurse in the evening would come in. That's it. The doctors who were there, because they could see me through the window, so they just said, hey, pick up your cell phone. I'm going to call you on the cell phone. So they asked me how I'm feeling, how's the breathing, how's everything going on, things like that, and then adjust the medications. They did continue in the hydroxychloroquine Zithromax, but still was not working. They gave me another antibiotic because I felt at that point that I had some sort of bacterial infection, and I started getting better. Thank God I did not need to have any oxygen. I did not have to be intubated at all. But I'll tell you, those 4 days in ICU were real living hell. Excuse my language here. The reason was, number one, the cough. And I always tell my patients and people who are asking me, I said, imagine you're in the ring with Mike Tyson and your hands are tied behind you and you have no protection. And he's just whopping at your head all the time. Now the cough, when you get it, is a very hard cough that your head really rattles. So your brain inside your skull is rattling away. You get these spasms that can go on for 3 minutes to up to 5 minutes or so. So you're just coughing away like crazy. That's a Mike Tyson punch to the head. The next punch is to the ribs, because your ribs start hurting you after a while, okay? And on Monday, I really remember holding my knees up to my chest area, tight as I could, because I felt my ribs were gonna crack any second. And I knew that if my ribs were gonna crack, they'll have to intubate me because the pain would be horrible, and that had to put me in a coma type situation. So I was very, very scared at that point. But because Dr. Isa is one of the clinic specialists in infectious disease, he saw me on a Monday. He said, you know what, I'm going to change you to different medicine here. And he did. And by Tuesday, I felt 30% better. I'm like, wow, you got the right combination going on, buddy. So keep at it. And so by Wednesday, okay, the cough had started to go down. The spasms were still there, but it's less frequent. So I was like, okay, I'm winning the fight against Mike Tyson eventually here now. And by Thursday, it was good enough that they sent me home. Now, when I got home, the cough is still there, but it's getting less and less. The fatigue is there because each day in the hospital takes you about 5 days to recover. So when I got home, just before that, I called the kids up. My mom, who's 85 years of age, was at home. So I told them, take her to Dallas because my niece is there. So they took her to Dallas. And I was on the 3rd floor. We have a townhome. So I'd sleep in the bedroom. My wife would sleep in the living room, and the kids were downstairs. Inside the house, wearing the mask all the time here, whether I was going here or there, I wore the mask all the time. Hand washing frequently. My wife went stir crazy with the Clorox, so the whole house smelled full of Clorox everywhere. My clothing was in a separate hamper, so it would be washed separately from the rest of them. Dinner or lunch itself, we have a long table. So I'd sit at one end with the mask on until I was about to eat the food, and they'll be sitting at the other end, at least have some conversation. and my plastic plates and plastic, cutlery, so it could be thrown away itself. I supplemented myself with vitamin C, mega doses, zinc, hydration with coconut water, turmeric, which is an Indian herb, which is an anti-inflammatory. So I made sure I took plenty of that. And as the coughing aspect, the inhalers and everything else was not working, what I found is the inhalation, the steam inhalation. So my wife would boil some water, and we had this powerful eucalyptus oil. I put a few drops of eucalyptus oil and just put my head on top of the towel and breathe. And that really opened up my lungs, and I felt so much better in that aspect. So that's how I finally got over it. And then it took another few weeks to get the strength back. So by the third week, I was able to walk a little bit more. And the fourth week, I was able to walk about a couple of miles around the area. Now my test, which was through the nasal swab, was positive first time. 2 weeks later, repeated that test, still positive, which surprised a lot of people. Then I said, okay, I'm going to donate my plasma if I got antibodies. So I contacted UTMB. They go, okay, why don't you do this? It's been about a month, so we'll have you come in and do a test. Well, that test initially was still positive. So, okay, we have 3 tests positive. It's been a month. I talked to the researcher, and she said that they are seeing people with a positive test almost 6 weeks after they get exposed. Does that mean that they are passing the infection during that time? Nobody has an answer, okay? It might be just genetic material that's laying back there in the back of the throat that we are detecting. So finally, when I went a week later on, they did the test again, and that test came back negative. So they took my blood and looked at the antibodies. They go, okay, your antibodies are present. These are the long-term antibiotics that sort of protect you. And so you can donate your plasma if you want to be part of the research project, which I did. And I've given about 3 plasma donations so far. And those plasma donations are given to people who are sick, okay? Those who are possibly going to crash and be on a ventilator. And once you get on a ventilator with the COVID, the outcomes are not that good, okay? So that's what you're trying to avoid, is a ventilator at that point. But it took a long time. And so finally I got well enough that I was able to walk then 3 miles or so a day. And now I'm back to my practice. Yes, I have the antibodies, but this does not leave my sight. No, I still wear it. One is I need to still protect. Why? We don't know whether when you have the infection, are you going to obtain it again from somebody else? Nobody gives an answer because we do not know, okay? And also, I don't want to pick up something else from somebody else at this point. I want to make sure I'm productive in a physician because I have a lot of people who rely on me. And number 2 is social support for people who are wearing this. You're doing the right thing and I want to support you, so I'll wear it also. So when I go outside, grocery, whatever the case may be, I'm wearing this. From the parking lot into the hospital, yes, I'm still wearing this, okay? Because that's part of the equipment that I have to have all the time. Hand washing, absolutely. Yes, you have to do it. Distancing, yes. Now, remember, I got home, wife is there, kids are there. I've got 2 kids. So far, no, they're negative because we maintain very strict hygiene and protocol at home. So we have tested them multiple times and they have all come back negative, no symptoms. So it tells you it's very important what we did. What I did at home is what everybody should be doing, and that's what the CDC is recommending also. So the virus and the testing, there's been lots of questions on that. The best one is the nasal swab, okay? It's called PCR. That's about between 95 to 98% effective in detecting it, okay? So symptoms or a little sore throat or this and that or possible exposure, yes, the PCR will detect it. The other test is a blood test. Now, there's 2 versions of the blood test. The one that you get drawn through your arm that's sent to the lab, reference lab like LabCorp or Quest or one of those big ones itself. There's 2 antibodies that detect. IgM, which is a short-term antibiotic, which means that when you get an infection, that's the antibody that jumps up right away to help protect you. That starts building up about 3 to 5 days, and about 7 days is really up there, okay? So if somebody says I've been sick for about 2 weeks or so, and they're refusing to get the nasal swab for whatever reason, then the blood test. Now, if somebody says, hey, in February, I had this nasty cough and I was sick for a whole week, but I didn't go to any place, or I did go, but they said it's a virus, just live with it. Maybe that was COVID. Okay, well, we can do the second, another antibody test, which is same thing to the blood, and called IgG. That gives you the long-term antibody, and that's what I have, is the IgG. That protection. Now, the question is, how much immunity does it offer? Nobody has an answer. And how long will it last? Well, there was a small preliminary study that showed that maybe that antibody protection may only be for about 4 months or so. So I'm coming up, because I was in March is when I was get exposed. So next month, I'm going to be checking the IgG to see if my IgG is still present. And then every month after that, I'll check myself to see in my own mind, my protocol as to how long that antibody protection is going to last in my system. But I'm still not going to get off the mask here at all, okay? Now, the other one that we have is a finger stick. The finger stick is the one that's 15 minutes or so it gets instant results. Some people either work-wise or something else going on, they need to know the results now, okay, for travel purposes or whatever. The problem with the finger stick is that there have been emergency FDA approval, meaning that they can do it, but we don't have backup of studies to show how good. The reference ranges are anywhere from 40% sensitivity to like 85% sensitivity, depending on the production. We're finding out this COVID testing, the finger stick that were produced overseas, they have a lower sensitivity rate than the US made ones, okay? So the US made one that we have that we are using for point of reference, we call it in the office, that's 85%. That means you have an 85% chance of it being sensitive, but you still have that 15% chance you can get a false report. So sometimes when the patient's questionable about, hey, exposure, or they have symptoms, I'm like, go for the big guns, get the nasal swab done itself, because that's going to give you a best answer, really, if your genetic material is there. Okay. So those are the things that I can tell you. And I'm sure if you have questions, I'm willing to now entertain any of those questions itself.
Okay, do we have any questions? Rebecca, I think you had one. Do you want to take it from here?
Thank you, Dr. Moosa. That was very informative. As much as I think I know, I learned a lot with your talk, and it's great to see you looking so healthy now after that long journey. My goodness.
Right.
And, you know, even being a healthcare professional, I know it's still frightening when that happens to you because you're supposed to take care of everybody else. I was wondering, are your lungs clear now? Is there any long-term damage to your lungs?
So far as I know, I've been able to do a lot of breathing exercises and things like that, and I'm fine. Unfortunately, we are seeing a lot of folks who have had lung damage, and I just actually saw a patient for the wound care, but she had COVID before. I saw her, and she now has permanent lung damage, and it's kind of a rare thing where she actually has air trapped between the lobes of the lung. So you have on the right side of your lung, you have 3 lobes, 3 sections. On the left, you have 2. In between the sections, it's supposed to be just a film, okay? And they're supposed to be nice and tight. In her case, there's pockets of air that are pocketed in there. They're sort of locked in there. So she gets short of breath. She cannot take a deep breath in, and her stamina also is affected. And so every now and then she'll need to take oxygen because the lungs are squeezed. So we are seeing some permanent damage to the lungs, and we keep hearing more and more as more data comes in that this is something going on. We do not know how long it'll last on those patients. Some of them we think is permanent damage. So it's still a question about it, but thank God my lungs, because I never smoked, no COPD, nothing like that. You know, so I think that's why I recovered better, but it's unpredictable with this virus.
Thank you. Appreciate that. We did have another question. If someone finds out they have been exposed, is there a certain time period to wait prior to testing for it to be effective?
So depending on the type of exposure, okay, if you were in an office setting, but the person's far away and you're, in mask and everything else, the risk is much less. And probably at that point, you may want to wait to see if any symptoms occur or anything like that. But if it's somebody close by, you can probably get it from them, and your test may be positive around 3 to 5 days or so itself from exposure. Now, symptoms is the other thing that some of the doctors are waiting for. In each individual, believe me, you have to talk to the doctor because they'll look at your history. So let's say somebody comes in and says, I was exposed yesterday, but I know they have emphysema, they have diabetes, all those other complicating factors. So I know that they are more high risk. I may want to do a test early now because their virus may be multiplied much faster in that person, okay, compared to somebody else. So I'll probably go ahead and quickly do a test on them so I can be on the forefront with them. The problem is, treatment-wise, we are still unsure, really, about outpatient treatments. There's a medicine that's available. It's in the hospitals itself. Gilead, the pharmaceutical company, is making that, but it's only meant for those people who are in the hospital and about to be on a ventilator type of situation.
Thank you. We have another question. I got tested last week and test came back negative. What is your recommendation on when is a good time to get tested again if there are no symptoms?
So if there's no symptoms and the test is negative itself, and depending on the test, remember, if you had the finger stick test done, it's 85%, so there's that 15% false negative that you can get. When we go by the symptoms at that point, if you have very close exposure, the CDC is still recommending 2 weeks of quarantine type of things itself to be done. Some people, now this is the thing about it, CDC a few weeks back had said that if you're exposed but no symptoms and test was possibly positive, you can still work with the mask and social distancing and everything else. Then they changed it. Wait a minute, they said positive test, no, quarantine yourself. So that's where we are. So if it's negative and you're doing the mask and all those, the distancing and everything else, you can go back. You don't need to retest at all unless you have symptoms.
Thank you. This person did say they got the finger stick and the swab. Another question.
The swab is the one that I would really rely on. So the negative, that's a very good test that you had done then.
Good deal. And I will mention, a lot of people are scared of the swab. I had it done. It's 10 seconds and you're done. And
yeah.
It's not something to be afraid of, in my opinion. So, and
I'll tell you, there's a thing right now that people are doing where it's a self swab. You go to some of these places, they give you the swab, you have to do it. If you're not doing it correctly, I'm sorry, you're not going to get the results. And so that's where I don't like that test itself. You have to really stick it way back and you should feel it in the back of your throat. Then you know you got it. And there's a line on the swab. It tells you, okay, this is how far you have to stick it. There's a line here. So you can't just stick like 1 inch and take it out and say, okay, here it is. No, that's useless there. So you have to make sure if you're going to do it yourself, you have to follow the protocol and do it. And the swab is, so if this is the face, it's going straight back here, not to your brain area, okay? Don't put it that way. It goes straight back because that's how the nasal cavities then go to the back of your throat.
Thank you. Another question, if someone has bronchitis, is that considered a higher risk factor for problems?
Yes, so any kind of lung diseases, asthma, COPD, chronic bronchitis, any of those, yes, the risk is much higher. The droplets from this virus make a beeline straight into the lung area. That's what the coughing and everything else comes on. And when I was having the coughing, they gave me the inhaler, they gave me codeine medications, these Tessalon Pearls, Mucinex DM. I was taking like whole, a soup full of medicines, and no, it was not touching me at all, really. So anybody with the lung problems like that, I really emphasize, please stay home. And people are saying, well, some people have an exception to wearing a mask outside. They should not wear it. And those are the people, well, they should not be out in the first place, actually. I'm sorry. Either use some services to get shipped to home, groceries or whatever, call friends, call family. There's lots of organizers willing to help you, but you should not be going out if you have any lung disease, really.
And I know there's been a lot said about children, and I know we're all seeing children out with their parents, and the parents have on a mask and the children don't. The statistics are showing younger people are getting this, correct?
Yes. Unfortunately, there's a rare case where they get this inflammatory reaction. And when you call inflammation, just think about it as fire, okay? The higher the inflammation, the higher the fire. And so these kids are getting this inflammatory reaction that the eyes become red, the whole body really swells up. It also affects the heart and the lungs. And so these kids are ending up on ventilators in the hospital area itself. And it basically causes what they call multi-organ damage. So the kidneys, heart, everything gets damaged. So I really get very upset when I see parents with the mask and the kids, you know, if you go to a store, they're going to touch everything really and anything. So I prefer that, you know, keep them home if you want to get something out. If you want to take them for an ice cream type thing itself, maybe you keep them in the car, you go get the ice cream and then bring it back to them, you know, something on the line. Or if you're getting an outing, and if you're going somewhere in the park or at the beach area, something just, and there's nobody there and you just want to take a quick walk with them for about 30 minutes or whatever without a mask, okay, fine. I can see that occurring itself because it's open area itself. But believe me, you don't want to take a chance if anybody's around them at all. No.
Thank you. We had another question, and this one comes up a lot. What kind of mask do you recommend wearing?
Okay. So the mask, you know, the surgical mask, which are the clothing type things itself, are good enough, really, for the general public. If you're going to be in ICU setting where the person's on a ventilator with a lot of, you know, filtering, that's where the I-95, you know, the N95 and other masks really come into place itself. So for the general public mask right now, there's a study done that showed if two people did not have masks, it's about 90% chance of transmission, okay? And if two people, both of them had the mask on, less than 5% chance of transmission. That's a huge drop, okay? So it tells you mask. Now, the virus is based on droplets. So if you have a bandana, if you have a scarf, if you have something, those droplets are pretty big droplets, really. So that material will trap the droplets. Droplets is where the virus lives, okay? So any kind of covering itself you can have, because some people cannot get this, unaffordable, whatever, but they have scarves or other bandanas at home. Go ahead and use it. At least use something rather than nothing, really. So you want to keep that covered.
Thank you very much. And there has been a lot of talk about that. Another question we had, if a family member is in a nursing home and an employee there tests positive, is the nursing home required to notify us if that employee was in contact with our loved one?
Each facility has their own rules and things like that, but technically they should. Now, there was a case where a patient of mine called me and said that his wife works at one of the stores, and one of the employees was positive, but the store does not reveal which department the employee was, the one who was positive, which department, what shift, was it day or night shift, nothing like that. They just we can just tell you that it's positive and that's it. So now the problem is that employees, because they're so short-staffed in hospitals and nursing facilities and things like that, so sometimes these employees are doing double duties with a lot, and normally they would not be in the room itself. So it's kind of hit and miss if the employee was in the room or not in the room. But technically they should notify you if any of the employees was positive.
Thank you. Appreciate that great information. Do you have any closing comments you'd like to give us before we turn it back to Cindy?
What main thing is, okay, listen, this virus, we do not know anything about it as likely we should be with other viruses. All the experts out there are changing their stance or their recommendations based on data. And each day we get new data. The problem is some of the data is flawed, okay? Meaning that it was not done in a proper scientific setting. If you're looking online, if you're looking at a website or anything like that, always take a step back and saying, where is this coming from, okay? I would recommend go to the CDC or the Mayo Clinic or the Cleveland Institute. Those are reputable areas, okay? You're going to get proper information. So that's number one. Number two, how long is the virus going to be around? We don't know. Number three, vaccine. The vaccine is being made and the government has poured in lots of money with that along with the industry itself. When will the vaccine be available? According to the best guess estimate, will be early next year. I hope that the medical community stands up strong and pushes back against any political pressure to try to get it out earlier. If the vaccine safety data is not there and is pushed out too early and something bad, disaster happens, a side effect or whatever, it'll be the biggest black eye on the medical community, but also it'll give the anti-vaccine people more ammunition to say, hey, other vaccines also need not to be given to people itself. So that will create a huge issue. So I'm hoping that if you or your family members have any influence itself and you're seeing this being pushed by politicians saying, okay, where's the medical community? And let's support them in getting this out in a proper way. Is a vaccine going to be one shot and for lifetime or once a year like the flu shot? Nobody has an idea right now because we don't know how long the antibodies are going to last. Like I said before, preliminary studies showed only about 4 months or so. I'm going to do my testing, but only time will tell. So by the end of the year here, the people who are infected in China itself, if the Chinese government is willing to really share honest information and get the proper data to us to say what were the antibody levels in those people who were diagnosed a year ago, to give us some more information and more armamentarium itself. Medications. There are no antiviral medications right now that are in the pipeline for this virus yet that we have heard of, okay? There are medications that are given in the hospital type setting, but there's a lot of data from overseas, from other countries about medications that they have that they've used, but we don't have any FDA stance on it, and we need to have the FDA really vet this out, okay? So those are the things I said. Now, I absolutely strongly urge you, please wear this, hand wash and distancing, and that's until next year when we find out more about the virus.
Thank you very much. This has been incredibly informative today, and we appreciate your time. We know that you're so busy and you had to take time out of clinic to do this for us, and we really appreciate it. And thank you, and I'll turn it back over to Cindy.
Thank you very much.
Thank you, Rebecca and Dr. Moosa, for your very informative information. You know, you're really not the demographic that we are hearing about so much with as healthy as you are. But the proof that you got it and there's 3 other people in your home that did the right thing, that is proof that following those guidelines prevented them from being ill as well. So I'm definitely going to call your wife. It happens in my household, and she can give me some guidance on, okay, do this, do this, do this. So I think she'll. Yeah, exactly. But I know what to do.
The only thing I would say that unfortunately we are seeing the virus being spread out so much that it's a matter of time before a lot more people do get it. Really.
True. Mm-hmm.
And number 2, I do want to give you something which is good news in a way. The last time I talked to the researcher at the hospitals where the plasma was being given, I asked him, I said, when is the plasma being given? They were giving it at the point when the patient was intubated initially, okay? But people itself, they found that they did not do well compared to control group. So they changed the protocol where the plasma is given much earlier. The problem is people sometimes wait too late, and by the time they go to the door in the ER, they're already being intubated. It's too late. So I would remind anybody that if you have somebody, either yourself or family members with lung issues, and they do get COVID positive, is to say, hey, are they going to get into a situation where we need to maybe think about giving plasma earlier than later on? That's what the protocol is right now at the hospital, right? Okay. And also he told me the severity of the virus is going down a little bit. Instead of seeing the very severe cases initially back in January or so, we have noticed that we are seeing, yes, a lot more cases, but the severity has declined a little bit, you know, on this virus. So I'm hoping that the severity keeps low, because if the virus mutates a little bit more and the severity goes opposite direction, we'll be back to square one. So I'm hoping that people keep their aspect, and so let the virus, response go down a little bit more, and hopefully the strength of the virus will go down.
Do you think that's because the younger generation is getting the virus, because we know that at first it was those more susceptible or then, and now it's, you see across the gamut of younger folks or whatever. And so it's not, if you're not exactly that person that's compromised, your health is compromised, maybe it's the younger generation is not getting it as severely.
Yeah, also we do know that a lot of these viruses, when they get out more broad itself, the mutations occur and some other viruses mutate with it itself. So it's a combination of factors. So it's the healthier population, more resistant type immune system, and their multiplication of the virus can be, with each replication, it can change its characteristics. So there's a lot of factors, but if it maintains this way, hopefully it'll be less severe to the population. But yes, we are seeing the demographic where 18 to the 40 range, that's where the highest ranges are right now.
And you feel like those folks are not getting it as severely as the first round? Right. Yeah.
And
okay.
I mean,
that
the number
sense.
of deaths when UTMB did the 50,000 test itself, and about 3,500 or so were positive from that. When they look at the number of deaths itself, the only problem is the university only counts deaths that occurred in the hospital.
Correct.
Patients transferred to other facilities or whatever, and they had about like 80 or so from the 3,500, about 80 or so died in the house itself. And this is more recent data from in April or so.
Well, you talked about one of the characteristics is pneumonia. And is it all, and then you talked about your ribs hurting. Is pleurisy also another characteristic, or have they figured that out?
No,
pleurisy hurts.
Yeah, it hurts like crazy.
Yeah.
And that's what I think, that's why my ribs are hurting on one side, because I think I had pleurisy on that aspect on the left upper area. And that that I felt was going to pop through my chest any second. But yes, you can get pleurisy and then the inflammation in the lung tissue itself, but you can also get fluid in the lung cavities. And also it affects the heart, we are finding out. And we are seeing blood clots being formed in patients with this virus. So that's where the strokes and other things are coming on more board. We're seeing people who have blood in other organs also, and that's from this virus.
Yeah. Well, we appreciate your insider information, both from the medical side and from the patient side. And we just really appreciate you taking the time today to join us and just your willingness to share what this affected, how this affected your practice, your family, and yourself. So thank you so much for being with us.
Thank you for having me on board
today. And also Clear Lake Specialties, we appreciate your sponsorship. And thank you all for joining us this morning. We had a good group here. I want to remind you to visit our website calendar on clearlakearea.com for upcoming programming and events. And if it is this time works for you to market your business, we have some sponsorship opportunities available with webinars and our upcoming new teachers luncheon. A little bit different this year, but still those opportunities to market your business. That luncheon will be on August the 5th. So please contact one of our staff members to confirm your sponsorship, or if you've got questions about one. We want to thank you again. Enjoy the rest of your day, and please have a great holiday weekend. Thank you so much.
Have fun. Bye-bye.